Good morning, everyone, and thank you for joining us for this week's epidemiological summary. Let's get started. We'll start off by looking at the situation of COVID in Canada, followed by what's happening in Ontario, and rounding up with what's happening locally in Windsor-Essex. Looking at the last curve, or the most recent curve in our fourth wave in Canada, it looks like we have reached a peak and our cases in the country are starting to plateau. The current 7-day average is about 4,300 cases, which is the same for what we were seeing last week as well. Moving on to what we're seeing in Ontario, the current 7-day average for Ontario is about 620 cases a day. This has decreased from last week, where we were seeing about 700 cases a day. Our cases in the province are starting to decrease. When we look at what's happening in Windsor-Essex, just like last week, we are seeing a decrease once again in this past week. Our current 7-day average is about 40.3 cases per day. This has slightly decreased from last week, where we were at 42.6 cases per day. When we compare our week-to-week incidence rate per 100,000 population, if you look at the last two bars, you'll notice that they have remained relatively unchanged. In our most recent completed week, our case rates were 65.2 cases per 100,000 population, whereas last week we were at 66.4 cases. When we look at what's happening in the most recent 7 days, our case rate is 62.5 cases per 100,000 population, and this has gone down slightly from what we were seeing this time last week, which was at 68.9 cases per 100,000 population. Our weekly case rate remains relatively unchanged, which can be found in the blue line when we compare ourselves to the province as a whole in the orange line and the other regions in the southwest in the green line. The other regions are seeing a decrease in their case rates, and overall we are too, except for if you compare this week to last week, there was only a slight decrease observed. When we look at our wastewater surveillance data, the red line, our wastewater surveillance data follows a similar trend in what we're seeing with our case counts over the past 4 weeks. Overall, there has been a decrease in levels of COVID found in our wastewater surveillance data, and it's currently consistent to what we're seeing prior to the beginning of the fourth wave here locally in Windsor-Essex, which was towards the end of July. This figure looks at all of our tests and the percent positivity of those tests as it relates to COVID-19. For the week ending on September 25th, our percent positivity was 4.7%. This, unlike some of our previous indicators in the last slides, has increased. This time last week, our percent positivity was at 3.9%. Approximately 5,000 tests were completed last week. When we look at the most recent 7 days, our percent positivity for Windsor-Essex is currently the third highest in the province and sits at 4.2%, whereas the provincial average is 2.4%, almost double. When we further break down a percent positivity by our age groups, we see that in the 0 to 17 year age group, there has been an increase from last week, where our current percent positivity is at 4.6%. Most of the other age groups remain relatively unchanged, though there has been some fluctuations in the past 7 days. When we look at our case rates per 100,000 by municipality from September onwards, you'll notice that Kingsville, Leamington, and Windsor have the top 3 rates. Now, when we look at the distribution of our cases across all of our municipalities in the past 30 days, from August 30th to September 28th, most of the cases are still coming from the city of Windsor, followed by 9% of the cases from Leamington, and 7% each from Kingsville, Lakeshore, and LaSalle. When we look at the most recent 7 days, almost 58% of our cases are coming from Windsor, 9% from LaSalle, and 8% from Lakeshore. Now comparing our overall breakdown of our cases by age and sex distribution in the past 2 weeks and looking overall, we continue to see 30% of our cases in our 0 to 19 year age group, and this was the same as in terms of what we saw last time around, last week. Overall, during the entire pandemic, only 14% of our cases were from our 0 to 19 age group, 19 year age group. When we look at how our cases are acquiring COVID-19 from September onwards, you'll see that there is a mixed distribution of cases, of acquisition sources. And from here, it looks like they're getting it from their household contacts, from an unknown source or from the community, and from close contacts as well. When we look to quantify those acquisition sources for the month of September, you'll notice that 34% of our cases are acquiring from the community, 32% from a household contact, and 17% from a close contact that's not from their household. This slide, it looks at our school-age cases and their distribution throughout the pandemic. Though our numbers are declining in our school-age numbers, in our school-age cases, the levels are high in terms of what we saw in our second wave, where schools were closed, and at the peak of our third wave, where we experienced a milder burden of illness in our community. When we compare our 7-day average trends in school-aged children and our overall population, we see that there is a disproportionately higher number of cases in school-aged children relative to the other age groups. While overall case counts are going down, so are cases in our school-aged children, but they still are higher than what we're seeing in comparison to our other age groups. When we further break down our younger age groups and look at the age distribution amongst them by the percent positivity, about 5% of tests within these age groups across all of the 3 age groups, 4 to 8, 9 to 13, 14 to 17, are returning as positives. Though this has decreased over the past 4 weeks, it is still higher than what we experienced in all of August. This is a new slide looking at the top 10 symptoms in children and adults in the past 4 weeks from August 28th to September 24th. In adults, which can be found in the green bars, the top symptoms were cough at 52%, nasal congestion at 42%, headache at 40%, and feeling tired or fatigued at 38%. In children, which can be found in the blue bars, the top symptoms were a cough, fever, nasal congestion, and feeling tired. You'll notice that these percentages don't add up to 100%, and that's because each person can report more than one symptom. Here we are looking at our variants of concern. We can see that the alpha variant found in blue dominated our cases in our mild third wave. Now, however, the Delta variant is our dominant variant locally and accounts for the majority of our cases. When we compare our hospitalizations to Ontario, and in terms of what we're seeing in Windsor-Essex, in Ontario, hospitalizations has generally remained unchanged from this time last week, whereas in Windsor-Essex, we have seen an increase. When we look at our ICU beds and the COVID-19 patients in our ICUs, in Ontario, ICU admissions have decreased this past week, and the same can be said for what we're seeing in Windsor-Essex too. Now looking at our doubling time In Windsor-Essex, our doubling time has decreased slightly, indicating signs of improvement of COVID-19 locally. The doubling time in Ontario is also improving and is currently better than what we're seeing in Windsor-Essex. In Canada, the doubling time in Canada remains low due to the current activity in other provinces. Our most recent estimated median R naught is 0.88. This is roughly the same where we were at last week, which was at 0.9. When the R naught is less than 1, it means that each existing infection leads to less than one new infection. This signals that our cases are decreasing in our region. Now moving on to our vaccines. In the past 7 days, about 63% of our doses were administered as second doses. We are currently administering about 420 first doses in our region in the past 7 days. This has remained relatively unchanged from what we were experiencing last week. You'll notice too that we have started to administer booster shots in our region in a subset of our population, which can be found in the orange bars on this graph. Zooming in to September onwards, we can see that there has been some variation in terms of the number of doses we've administered. At times we have administered more first doses towards the beginning of September, and there were times currently where we're administering more second doses. And then since the beginning of September, we have also started to administer third doses as well. Now if we were to look at all doses and the 7-day average in terms of doses administered to our residents, currently we're administering over 1,200 doses daily. This is higher than what we were seeing last week, where we were at approximately 1,100 doses. When we look at our coverage rates overall by our age groups, we can now see that over 72% of our youth 12 to 17 have received at least one dose of the vaccine. Overall, if you include everybody, approximately 73% of residents in Windsor-Essex, even those who are not eligible, have received at least one dose. For those 12 plus who are eligible, 83% of our residents have received at least one dose. Now when we were to look at fully vaccinated individuals, if we were to look at our entire population, which includes those who are not eligible, 67.5% of our residents are fully vaccinated. And those that are only eligible to receive the vaccine, just under 77% of our population are fully vaccinated. If we were to look at our vaccination coverage rates by our hotspots, you can see that still, which has been the trend since vaccinations was implemented, hotspot coverages has remained lower compared to overall coverage in Windsor-Essex. Some areas have a higher coverage, such as our N9Y postal code, whereas the N9A postal code has a lower vaccination coverage. And the similar trend follows when we look at those that are fully vaccinated. Just over 50% of all residents, including those unvaccinated or ineligible to get the vaccine, in the N9A postal code are fully vaccinated. So how do we compare when we look at all of the public health units in Ontario? So we're currently below the provincial average, and we're also in the bottom half of the province when it comes to coverage rates with at least one dose. And the same holds true when we look at those that are fully vaccinated as well. In summary, case rates in Windsor-Essex have remained relatively unchanged this past week. Our wastewater surveillance data highlights the continued decline in COVID-19 in the region. COVID-19 related hospitalizations has increased, but ICU admissions have decreased locally. First and second dose administrations have increased for this week. When we look at our monitoring indicators, for the most recent completed week, 65.2 cases per 100,000 was our weekly case rate. In the most recent 7 days, our case rate was 62.5 cases per 100,000 population. Our percent positivity did increase this past week and sits at 4.7%, whereas in the most recent days, it's at 4.2%. Our median R naught has remained unchanged from last week and sits at 0.88. Outbreaks, though, continue to remain high in our region. 83% of residents 12 plus who are eligible to get the vaccine have received at least one dose, and almost 77% of our residents 12 plus are fully vaccinated. Thank you.